everyone, I'm Eunice Olsen and I'm currently here at the Specialist Women's Imaging Clinic with radiologist Dr. Ramesh, and I'm about to go for a mammogram screening, and I thought I'd ask Dr. Ramesh a couple of questions before I go for screening. So Dr. Ramesh, thank you so much for taking time off your very busy schedule to answer some of my queries. Perhaps I can start by asking, why are mammograms so important?
It's important because mammograms have been proven in multiple studies to be able to save lives from breast cancer. And the way it does that is by picking up the cancers early. So when cancers are detected at an early stage, it optimizes your survival from the cancer.
I see. And in Singapore, what is the recommended age that women go for mammograms?
Right, in Singapore the guidelines starts from the age of 40, in which women are encouraged to speak to their doctor about screening mammograms and to start going for screening mammograms once a year, every year from the age of 40 to 49. And then ladies aged 50 and above, they are encouraged to go for their mammograms once every 2 years.
Okay. And like you said, it's once a year for above the age of 40 and once in 2 years for above the age of 50.
Yes.
And I guess another question that I have, which is kind of also feedback, right, that I get from people, is that a lot of people are afraid to go for mammogram screenings because perhaps this fear, what if there is something wrong? And maybe perhaps you're the best person to give advice. So what if women are feeling that way? What would you like to say to them?
Yeah, I completely understand the fear because it's very daunting to know what could potentially happen, right, with regards to the result. And the word cancer is a very big thing that could cloud over you. But at the end of the day, the fact is that there are many patients who survive breast cancer very well, especially if they are caught early. And catching it early not just increases the survival, but also it opens up treatment options for you. Let's not forget that the breast is a very important structure for the woman. And for that, there are many patients, rightly so, would be concerned about, for example, cosmesis, right? So that can be explored a little bit more, the smaller your cancer is. The other options is your chemotherapy or your radiotherapy. All these can play a role in treating you, and your options will be better if they're caught earlier.
I mean, we shouldn't be afraid of it.
No, not at all.
When we go to a mammogram screening, it's better to find out rather than to not know.
Exactly, and catch it early and treat it early.
I really like that. Catch it early and treat it early. Well, thank you so much, Dr. Ramesh.
You're most welcome.
I feel very comfortable going for my screening now, and I will see you at the consult later.
Absolutely.
Okay. Well, I'm all ready to go for my mammogram screening now. Remember to wear a two-piece so that only the top and bra can be easily removed for the screening, and do not put on perfume, deodorant, antiperspirant or jewelry around your neck. So I'm all changed in my Velcro gown and I'm ready to go for my mammogram screening. And I'm not really nervous because I've done this once before, it's my second time. And I've also spoken to Dr. Ramesh and Kim, the radiographer, so I'm very sure I'm in very good hands.
With the help of a radiographer, the breast is positioned and gently compressed between the compression paddle and the mammogram plate. A low-dose X-ray is then used to take multiple images of the breast.
Thank you so much for accompanying me on this journey. I hope Dr. Ramesh has addressed all your questions and also your fears. If you're thinking about costs, mammograms are heavily subsidized at all polyclinics, so please don't be afraid to take a mammogram, and remember that early detection saves lives and saves breasts.